So tell me, a woman comes in for a mammogram, her first mammogram. And let me tell you guys, speaking because I'm a woman, because I've had this done now for the last 8 years, I can tell you that it never feels the same, it never is the same, your apprehension levels are different. So when a woman comes in, just brand new off the street, who says, I'm here for my very first mammogram, what do you tell her? What can she expect when she goes back in and meets with Annette and she's all ready to go? What would she expect to happen to her?
Well, first of all, the current recommendations for a screening mammogram by the American Cancer Society are women who are 40 and above should receive a mammogram every year. Now, the situation is a little bit different if a woman has a family history of cancer at a young age. Say, for example, a sister was diagnosed at age 42. That patient should be screened 10 years prior to when her relative was diagnosed. So the 40 guideline is fine for women with no strong family history. But if there is a history of a family member diagnosed at a young age, then the screening should begin well before the age that family member was diagnosed. As far as coming for the mammogram, I mean, anxiety is normal for any type of diagnostic imaging test. Some patients experience more than others. But what I say to patients who are experiencing any level of anxiety is that the hardest part is showing up. When you walk through the door of the imaging center, you're halfway there. And it's my job and John's job and the other doctors who work here, it's our jobs and the technologists' jobs and the staff's, it's our jobs to get you through the other 50%. To get you through the test. And my feeling, our experience is that, in many cases we can relieve, not all, but most of the anxiety that patients have, especially with mammograms, because there's a lot of anxiety, and rightly so, associated with breast health and breast cancer.
So I like to just, if you don't mind, I think what's also good is when you come in and then you go back and you put the little pink little cape on and you go into the room, sit, talk to Annette, talk to her. She does the whole test, and then you're sitting there. Now you don't have to when the doctor, after you look at the actual images, thank you. You would go in, if everything's okay, you don't even have to, she comes in and says, hey, you're cool for another year, good, no problem. That's what happens on it's not like you have to say, oh, I have to sit with the doctor now, I have to do, barring any, problems.
It's your option.
Exactly. So you can do that if you wanted to.
If you come in and you want to speak to a doctor, that can happen.
Okay.
I mean, we're there, we're on site.
Exactly.
But if you're fine with Annette giving you the information, then that's fine as well.
Yeah, well.
The key is, though, is that you don't leave, as a woman, and a patient here, you don't leave without knowing whether your mammogram is clean, or whether you need additional views, or whether you need another test, again, to answer that question, is there a cancer there?